With an estimated 3.8 million sport and recreation-related concussions occurring annually, targeted prevention and diagnostic methods are needed. Concussions are the most common and the least serious type of mild traumatic brain injury. They frequently occur in contact collision sports when the head contacts an object hits the head, or due to a forceful motion of the head. Helmet accelerometers may be useful clinically in identifying when an athlete may have sustained a force to cause a concussion. My PO question is, can the use of in-helmet accelerometers in athletes in helmeted sports be useful in helping clinicians predict or identify sport-related concussions? For my methods, PubMed and Sport Discus were used to complete a literature search using terms helmet accelerometers, concussions, head impact monitor, and accelerometer and concussion. 5 articles were then chosen based on the following inclusion and exclusion criteria. The inclusion criteria included published in 2015 or later, full-text articles in English that were scholarly and peer-reviewed. Accelerometers not targeted for concussion measurement or commercially available were excluded. The quality of the studies were scored by the Pedro scale, ranking the scores as poor to high quality on a scale of 1 to 10. For my first article, this study compared the kinematic measurements of an accelerometer and a gyroscope. 2 helmets each had G-force trackers placed in 4 locations. Each helmet was then tested at different speeds and in different directions. Front and back impacts were done along the sagittal plane, lateral impacts were done along the coronal plane, and the oblique impacts were measured at 45 degrees from the back. Results had shown that peak rotational velocity had similar results for impact direction, but there were no differences due to the sensor locations in the helmets. For the second article, this study wanted to compare a new head impact monitoring system against reference accelerometer measurements while using a linear pneumatic impactor to a hybrid 3 with a football helmet with the monitoring system placed on the inside of the helmet. Linear regression analysis and absolute mean percent error were used to compare the head kinematics measured by the G-force tracker. The G-force tracker appears to be a suitable impact monitoring system, but with the various types of football helmets, correction algorithms will be needed to develop for each helmet style so they are more accurate with each impact. Results had shown that the coefficients were strong for peak linear acceleration and peak rotational velocity, but all coefficients were improved when the algorithm was correct. For my third article, this study assessed utility and functionality of the X-Patch tool for measuring head impacts in Australian football. A hybrid 3 head and neck model was used, and the X-Patch was placed on the mastoid process. Tests were performed on the front center of the forehead, left lateral, at 45 degrees, and the lateral chin. The results had shown that there was a significant correlation between the head form measure and device-measured kinematic parameters. It was concluded that the X-Patch devices should be limited to research only and in conjunction with video analysis. Laboratory head impacts measured at multiple impact sites and velocities identified significant correlations between head form measured and device-measured kinematics. The recorded peak linear acceleration was 17% higher than the reference peak linear acceleration, 28% less for peak rotational acceleration, and 110% greater for head injury criterion. The X-Patch system was also deemed wearable by 95 to 100% of respondents. For my fourth article, this study was a systematic review that wanted to assess head impact devices and their utility. A PubMed search was done using phrases such as accelerometer and concussion, head impacts and sensor, linear acceleration and concussion, and rotational acceleration and concussion. All articles selected tested linear and angular acceleration during head impacts with head monitoring devices, and all were sport-related concussions. The most commonly used device was the Riddle HITS device. It used a 6 single-axis accelerometer that would fit inside the helmet. The device would only collect data if it exceeded 14.4 grams of impact. Of the 61 articles that were selected, 20 presented with concussive events. It was concluded that the head impact sensors have limited applications to concussions because of error, and they should not be used for clinical judgment. Results had shown that sensors may provide critical real-time data to monitor players, but the sensors should not replace clinical judgment. For my last article, this study is a clinical review wanting to provide an up-to-date assessment of head impact devices used for concussion monitoring and to provide guidance on their clinical utility at a college, high school, and youth levels. A PubMed search was done, and 121 articles were selected. After narrowing it down, 48 articles met the criteria. 7 impact systems were identified. Single triaxial accelerometer was used inside the helmets. Results had shown that 10 of the 24 market or research-based head impact monitoring devices have publications supporting their utility, which suggests that some marketed impact devices have little to no research for their use. Impact devices may indirectly reduce concussion risk by influencing coach and rule changes. Limitations of this study included fixation of the accelerometer to the head, the helmet fit, and the device hardware should be considered. Without there being an injury threshold, clear accuracy, and validity, impact monitoring devices cannot replace a clinical's judgment, and they should not be used as a single assessment tool for concussions.